to be here talking about something that I'm really passionate about, which is the human-animal bond and autism. And as Lori had mentioned, I'm a doctoral student at Colorado State University. I've been working as a clinical social worker here in Colorado for the last 5 years, and prior to that in my home state of Maryland. And I'm in my second year. I just started last August. And so this PowerPoint that we're going to go over today is accumulation of literature review that I conducted on animal-assisted interventions and autism, as well as a combination of best practices as far as working with individuals with autism. So without further ado, so we're going to go a little bit over autism spectrum disorder in general. I'm going to define for you guys what I mean by aberrant behavior, and we'll talk about common goals for children and adolescents on the spectrum that animal-assisted therapy teams would fit into, and really go over some concrete ideas of exactly how that could look. We'll use the SMART goal format. It'll look very similar to the way that IEP goals are written, since this was originally training that we did for our volunteer therapy teams. And so most of them primarily work in the school system when they're interacting with children on the autism spectrum. So just to go over a little bit of information about autism and why this is important, the rates of autism spectrum disorder are constantly increasing. We know that there's a huge spectrum. It's rated currently on levels 1, 2, and 3, with 1 being the least impacted in their day-to-day lives, and 3 requiring the most significant supports in order to access the community. And so when I'm talking about autism and some of these interventions, not everything is going to work with everyone, because if you met one person with autism, then you've met one person with autism. By definition, what we're looking at are 2 primary areas of difference. So that's social and communication deficit, as well as restrictive and repetitive behaviors. And I always like to kind of address the restrictive and repetitive behaviors, because that could include the stereotypy that we think about, like hand flapping, but it could also mean just repetitive thoughts, really narrow interests, those types of behaviors as well. Aberrant behavior, as far as this PowerPoint and what I'm going to be talking about, is behavior that doesn't meet the social norms. So it could be as significant as physical aggression, but it could be as mild as classroom disruption, talking out of turn, blurting out. And so, again, very broad definition. And as we get into some of the goals and strategies, that'll become more clear as well. Okay, so again, because this training was developed, for volunteers who maybe don't necessarily work with individuals with disabilities, it's really important to go over language. So when working with someone with a disability, we typically use what's called person-first language. And that's where we put the person before the disability. So we say, someone with autism, someone who utilizes a wheelchair, not things like wheelchair bound or artistic. However, I will mention that there is a movement within the autism community specifically in which they're using identity first language more in a sense of like, this is part of my identity, this is part of who I am, it's not something that can be cured. However, unless somebody has explicitly told you that that is the way that they'd like to be referred to, we always use person first language. And so person first language is, if you're meeting someone for the first time, or you're in a professional setting and talking with other professionals, that is the language that we encourage everyone to use. So just getting into the nitty gritty here, I've separated this into 4 different domains. So we're going to start with some cognitive goals and areas that literature has shown animal-assisted interventions to be effective. So the first one that we're looking at is focus. And I, just quickly wrote a little focus goal here that you might see in a school-based setting. So by May 2020, student will increase ability to remain seated in class from 2 minutes to 10 minutes as measured by teacher reports and observation. The first time I did this training, one of the things I pointed out was maybe I should lower that a little bit, because one of the important things to keep in mind is having objectives and goals that are really obtainable. So 10 minutes actually can be a really long time to sit still, depending on what strategies are in place and the type of kid and the age and things of that nature. So, a jump of 8 minutes sitting still is a lot. So keep that in mind with that one. But different ways that we can kind of get involved in that goal. So if that's the type of goal that we see, talking about how the animal can model calm or still behaviors, and like having the opportunity to talk about how long can he sit, can you turn away from the therapy animal and still have them sit for the same length of time, practicing stay in different scenarios with different distractions and using that as a teachable moment to kind of talk about, man, when there's a lot of things going on, or when I'm over here playing with this toy that's really interesting to him, it's harder for him to pay attention to you, huh? Like, let's talk about that. And that provides an opportunity for learning. I also really enjoy our volunteers here at Habit. They have business cards with the animal's photo. So we know that hand fidgets are something that can really help a child with autism remain focused when in the classroom. And so that business card or some other special item that is hand-sized might be a good fidget that not only gives them something to do with their hands, but maybe reminds them too of the skills that you've worked on in the session. So that kind of transitional item can be really ideal in these situations. Another common goal that we see is following directions. And so there's lots of ways to engage your therapy animal when there's a goal around following directions. And I think it's important also to note that clearly a lot of these different strategies or ways to engage can go on multiple goals. So there might be ideas that pop into your head and they show up later on in the PowerPoint. So I hope that maybe at the end too, other people can share ideas that they have. So as far as following directions, I really like playing games with the children that the animal can potentially participate into. So Mother May I, red light, green light, other games where the clinician might be the leader, but the child could also be the leader. Practicing any type of cue and then giving the child a turn to be in charge and changing those roles back and forth with any type of situation like that is great. Using mistakes that the animal makes as teachable moments. And it's sometimes not all therapy animals follow every single cue perfectly, and that's okay. Those are actually opportunities to teach a lesson and talk about making mistakes and accepting that. The other big one for following directions or just expectations in general is using a social story. We actually do an entire, or are planning to do an entire training with our volunteers on social stories. So if that's not a familiar term with you, the simplest explanation I have is it's a very detailed book. Typically, we use photos of the actual environment or the actual animal, and then the book is supposed to explain what a child is to expect in any given situation. So we might use social stories to introduce a therapy animal before it meets with the child to get them ready and prepared. Or if there's a big change or transition coming up, like moving from elementary school to middle school, we might create a social story around that. I think the concept behind what we would use social stories for is that kids with autism really like things to be predictable. And so we're trying to explain things step by step as easily as possible so that they can anticipate what's going to happen next. And when we do strategies like that, it really helps to soothe and calm an individual with autism, maybe who's prone to anxiety or something of the like. Continuing with different cognitive goals, asking questions and problem solving skills are other ones that come up a lot. Sometimes asking questions will be part of the speech language pathologist's work with the child, but sometimes it could be the mental health professional. It really varies. And so turn taking and verbalization have been shown to increase when a canine is present. So whether you're using the animal directly in like a therapy type setting, or if the animal is just present in the room, more of an animal assisted activity type session, either one, both types have shown to have positive effects for kids with autism. The theory behind that is simply that the animals have unconditional love and acceptance. And so there's a safe, comforting environment that's created by their presence. So could be the child and the animal interacting with you, kind of talking for the animal, having the child go back and forth. You could also, expand that and having them learn facts about the animal, modeling what that could look like, and potentially even allowing them to introduce the animal to their classmates or one peer, depending on their comfort level and what they're working on. As far as problem solving, different clinicians have their kind of go-tos. I really like the way that a program called Second Step sets up problem solving. And so I'll use a lot of elements from there to teach problem solving, and use the canine as a scaffold. So maybe the animal has a similar problem or a similar conflict the child has had that you've learned about, and so you could kind of contrive that situation for the animal and have the child give the animal advice. Having the identified child come up with their own ideas on how to teach a new skill to the animal can be a really fun way to get them engaged in problem solving. If you have an agility animal, of course, creating obstacle courses, using only items found in the room so that the child kind of has to think out of the box of like, what can I use this chair for? Can this chair be used as a tunnel? Is the dog big enough to jump over it, or is he small enough to fit under it? Some of those different types of problem solvings that just excite and engage a child of any age. So moving on to our second domain, our emotional domain. Some of the goals that we might see around empathy or having a positive attitude. I utilize the zones of regulation a lot when working on empathy. And so that is from the social thinking curriculum, and we can, have a rating scale for the child and for the animal. So having your animal's zones of regulation chart made ahead of time, or working on it together with the child while they work on theirs, are some great ways to engage and share with the child some of the concepts that you want them to learn. Using photos to talk about how animals feel. I think that can teach not only feeling identification, but also could teach some important information about animal safety, right? So if we're showing photos of canines that look really agitated, we can talk about what a child should do in those types of situations. So it's creating additional opportunities for learning. In different situations within the session, you certainly could also use that as a teaching opportunity. So I have a kid that I'm working with now who tends to raise his voice. And one of the ways that we work on voice modulation is by talking about, oh, do you see how the dog is walking away from you? It really scares him when you use that more aggressive voice. Can you go back to the softer voice? And typically that will help coach the child to utilize the appropriate tone and volume, and it will also help with that identification, right? So when we yell at people, they walk away. And so always trying to turn that back around eventually, and connecting it back with humans. As far as positive attitude, I think, as I mentioned, studies have shown that the animals in the classroom, even just pets, can increase a child's enthusiasm about attending school. We know that children with autism often have very traumatic experiences for school-based settings, particularly those who perhaps have moved from public school to a more individualized setting. And so we want to utilize the animals when possible in order to help soothe the child and calm them, and again, create that safe space. I know for high truancy cases, we've utilized canines where we can actually meet them in the parking lot and kind of do almost like an exposure therapy little by little until the child is back into the classroom full time. Continuing with that emotional category, talking about self-esteem and confidence. So after mastering the cues, similar to before when we were talking about introducing the animal in order to increase verbalization, we can also show that mastery, to a small group of peers or an individual. That really helps boost their confidence because they're the ones who were in control and leading the situation. There's also an opportunity, I think, to kind of compare strengths and weaknesses and talk about how everybody has strengths and weaknesses. That's usually a pretty big one when we're talking about autism, particularly level 1, or what people colloquially call high functioning autism. Try not to use that phrase, but that that individual with autism who's maybe highly cognitive and highly verbal, but notices a lot of those social weaknesses. There's a lot of anxiety and self-esteem issues that revolve around that, particularly as they age. And so this could be a way to talk about those things in a comforting and safe space, and also identifying, what your animal's weaknesses are, because even animals make mistakes. Anxiety is a big one. And so a lot of the things that we've talked about already can work to help adjust that. But I think some additional ideas, practicing challenging tasks with the animal present can potentially help reduce anxiety. So we've talked a little bit with some of the teachers we work with about, wouldn't it be nice if we're able to have the canines present during testing? And, if we've worked with the child enough and normalized the dog's presence, and then it should be less distracting. Studies on that have been kind of mixed. It just depends, I think, on the history with the animal, the individual, particularly if the child has ADHD or not. I think those with ADHD have shown to ramp up sometimes if a canine is present, but that's not always the case. So that's going to vary depending on the child you work with. So again, comparisons between the dog, using the dog as a scaffold, talking about what the dog is afraid of. If the dog has worries, how does the dog manage their worries? One of my favorite activities is actually having the child lay on the dog or put their hand on the dog's chest and trying to match their breathing. There's all kinds of wonderful ways to teach deep breathing, but this is just one that we're able to do specifically with the canine. That's my therapy dog there, Abe, and that's when he was doing his training in Garfield County Public Schools, where we used to work. And just to wrap up the emotional category, I think the other common one is that isolation and depression. And so this, I think, again, can be addressed in so many ways, but just some additional ideas for people. I love writing letters because that can help with so many different academic skills in addition to creating that connection. So particularly if you know that you're going to be missing a week, that you would normally have the canine present, having the animal write a letter and allowing the child to write back. This is wonderful for during the summer or long breaks, if you're able to set it up that way, so that the child feels like, the animal's thinking about them and the animal remembers them and cares about them. Some of the other things that we consider is level of touch. And so this is not a suggestion for all animals, certainly depending on what your animal is comfortable with. But what we know about a lot of kids with trauma, or a lot of kids who are growing up perhaps in a very chaotic household, that there's not a lot of physical touch that they get. And so petting your animal, being close to your animal, that could be something that's truly significant and special to them. And we might not even know it. So that is one of the really special things that animal-assisted therapy can offer that perhaps one-on-one therapy with a clinician couldn't, right? Like as a mental health professionals, we don't typically hug our kids or give them that physical touch, but perhaps an animal could. All right. Cruising right along. The third domain that I broke things up to is the social domain. So eye contact was the first goal. So there's been studies that have shown that children with autism increase their eye gaze and eye contact when canines are present. You can practice with the animal how to do appropriate eye contact. Important thing to keep in mind about social deficits is that it doesn't necessarily mean that there's an absence of eye contact. Sometimes it could mean that it's socially inappropriate, like too much eye contact. So that could be one of the things that we're teaching. Sometimes kids are taught to make eye contact too overtly, and it's almost like a laser beam coming at you. So teaching, when you make eye contact with the dog, you're actually not looking them straight in the eyes. You're looking maybe at their forehead, or some of those different skills and ideas. Just in general too, clearly when you're first meeting the child and talking about how to greet an animal, some of those skills can roll over too, like how do we give a social greeting. And then one of the fun ones that I like to do is giving cues. At least this works with my dogs. Some dogs are really, really well behaved, and this might not be idea for that dog, but my dog, if you turn around and you're facing back to him and try to give him a cue, he typically is less responsive. And so it opens up, again, the ability to kind of talk about, like, when you're in class and you never look up at the teacher maybe doesn't think that you're listening. And so teaching some of those skills on how to demonstrate attention and demonstrate focus that are socially appropriate could really benefit. And as far as responsibility, our volunteers often, it's the kid's responsibility to set up for the animals. So the child could prepare the room, could set up the water bowl, different things like that. When working with individuals with autism, it's really important to know that there could be preferences, and that a lot of people with autism tend to be visual learners. And so using checklists or organizers that could then be transitioned over and used in the classroom or for other school-based tasks can be really helpful. And so there could be, a daily checklist of what needs to be set up for the therapy session. And then we can kind of work towards homework checklists or things like that. Okay. Just some additional ideas that don't necessarily fit into all of these domains. So as I mentioned, just the presence of the animal can really help facilitate and increase socialization in the classroom. That can be with peers or in small groups, in the classroom, or in just a smaller therapy session. In those situations, the animal can help facilitate the discussions between the children, or you as the adult in the room can help facilitate discussions about the animal between the children. And that seems to really increase engagement there. It gives them a mutual topic that they're both interested in, and helps identify similar interests. The other thing that is really evident in the literature is combining animal-assisted interventions with already existing best practices for treatment. So as I mentioned, like the social thinking curriculum, or the second step curriculum, depending on, what setting you're in, has been shown to increase known positive outcomes. And so in addition to increasing the positive outcomes that the best practice is targeting, I think there's also been additional gains of confidence and socialization, kind of regardless of what that intervention has been. So it really allows your animal to be that safe, non-judgmental ally to practice the skills being taught, as well as creating that safe space to even engage with the curriculum, I think, at a deeper level. The other thing that I think can be really, really helpful is reinforcing participation using the first then approach. That's a really common one with individuals on the autism spectrum. So perhaps there's a really difficult task the child has been putting off that week. So maybe during the therapy session, breaking that task into even smaller things. First, do 2 problems of the math test, then we will go for a walk. Thinking about how we can motivate, similar to like a functional assessment that we would do in ABA, by figuring out what activities with the canine are the most engaging to the child, and using that to break a difficult task into much smaller tasks. When we do that, we typically, again, try to put it in visual form. So creating a list, using timers, things that are really concrete in order to have the activity, again, something that's predictable, that the child knows what's going to happen next. And sometimes there's those days where maybe your canine that week isn't motivating, and they still refuse to do the work. If that's the case, one of the things that I think is really important to keep in mind if you're doing like a first then approach, unless you're going to cut the session short, right? Like make sure that then the reward is something different outside of what you would normally do, right? Because we don't want to punish them maybe for choosing not to follow through with the first then, but they're not able to get that additional reward. So perhaps going outside for a walk is not something you would usually do. So that's what you would choose as like a reward versus just being present in general. So things to keep in mind when creating a plan like that. I think it's really important to talk about aggression. And I think, in the work that I do, I typically work with individuals with autism and significant behavioral health or mental health co-occurring diagnoses. And so aggression is something that happens with the small group of individuals that I work with. So if you're meeting a child for the first time, and make sure to ask those questions, think about where you and your animal are positioned in the room. Typically, you would want to be the person closest to the door, so that in the event that something is triggering, you and your animal are able to leave safely, and the clinician who works with the child on a day-to-day basis can take over and kind of calm and soothe the session, and perhaps invite you back when it's safe and appropriate. But I think that as the handler of the canine, your responsibility is always to the animal's safety. And so thinking about your placement in the room is really important. Other considerations, because working with individuals with autism, again, such a spectrum, such different individual characteristics, we recommend that our volunteers carry gloves for children. So in case the children is sensitive to textures, really know your animal too. If your animal is shedding, or if your animal is a drooler, right? If your animal produces a lot of saliva, then maybe a rubber glove is more appropriate than a cloth glove, something that's disposable versus washable, those kinds of ideas. I always carry a lint roller with me as well. Lots of children with autism tend to be very particular, so depending on your animal and their hair situation, having a lint roller on you to offer at the end of the session might be something that's really important. Sensory needs vary so greatly, so it's really important to talk with someone who knows the child before the first session and try to gather this information so that you can be as prepared as possible. Not all children with autism are going to be good candidates for animal-assisted work. Some children with might have phobias, but some also perhaps are so sensitive to sounds that the anxiety that your dog could potentially bark might be paralyzing. And so knowing those things ahead of time and kind of observing during those first few sessions how things are going. Smell is another one. One of the interesting things about senses is that some children with autism have such heightened senses of smell and hearing that they might be sensitive to those senses. And so we want to make sure that your animal is clean as possible, that even if you have a very quiet dog, that it could still be something that invokes fear. So thinking about some of those different individual characteristics for children with autism are really important when creating a treatment plan. And so that is the end of my presentation. I know I went through that really fast. And so I am definitely open to questions or additional ideas. If you have worked with individuals with autism using animal-assisted interventions, perhaps there are some ideas that you would like to share with the group. So.
Great. Thank you so much, Tiffany. I really appreciate it. And there was a ton of information in the things that you presented. So what we typically do at this point is have a Q&A session where I'll ask everybody to type their questions into the chat feature. And then before I forget, because I should have said it at the beginning, but one of the other things that we'll do is I will send out an evaluation afterwards to everybody through, and it'll just be a survey that you take online. I would appreciate whether you're taking this for CE credit or not, that you just take the time to fill out that evaluation, because Division 17 of APA likes to see those, and I like to show that we have a lot of participation for these webinars, and that this really is an important field. So please take a moment to do that. If you are doing it for CE, the way that those work is that when you fill out your evaluation, then when you get done with that, then it will send you to another website, another survey, where then you fill out your identifying information. So it's separate from your evaluation. But I need all of that identifying information to be able to get you your CE credit. So I'll send those out. And yes, I will send out the PowerPoint as a PDF to folks. And then this will also be made available on the AAI website. So if you know people that are interested in listening to this presentation, the video will be available on our website. So, okay, I'm just looking over some of the questions that started coming up. And one of the questions was an idea for publishers for the social story, introducing your therapy animals. Do you have any thoughts about that, or thoughts about cost to produce something like that?